Good morning, and welcome to the Breaking Burnout for Nurses podcast. Today, my guest is Hepsharat Ahmadi, MD, and she is going to talk to us about natural supplements for energy, sleep, focus, and stress relief. Yay! Welcome, Dr. Ahmadi. Thank you for being here.
Thank you
First,
for
tell
having
us a
me.
little bit about yourself, about your career, and just what you like to do when you're not a doctor.
Well, I graduated from family practice residency in 1990. I went to Bronx, Lebanon hospital residency, and I always actually thought holistically. Sometimes people ask me, well, how did you suddenly decide that you wanted to be holistic? And I always was oriented that way. Even when I was in medical school and residency, I thought that things like nutrition were important. But I realized that medical school and residency really would not be able to help me in helping fairly well people get even more well. They're good for treating disease and stabilizing patients so that they don't deteriorate too quickly, but they really don't cultivate health. And I knew that from the beginning, that you can't take a healthy person and make them any healthier by giving them a medication or doing a surgery on them. So I aspired to actually help my patients increase their level of health without having to necessarily use more medications or any procedures. So a few years after graduating from residency, I went back to school for acupuncture and Chinese herbs because I knew that that was something that could help people. And I had seen one of my mentors do this. He combined his family practice with Chinese medicine and with homeopathy. And so that's what I aspired to do. So anyway, so anyway, the average medical doctor only monitors things for most of the body at two levels. One, the biochemical level through lab, blood testing, and the other, the structural level through X-rays and scans. But as far as what's going on electromagnetically with the body, they haven't a clue. And that's kind of a shame in my eyes because that's where everything starts. Everything starts first at the electromagnetic level before it can get to the biochemical or ultimately the structural level. So, being that I'm most concerned with disease prevention and health optimization, I am very concerned with the electromagnetic level. But of course, I also use the results of labs and also radiologists' reports of scans to be able to see what's going on with my patients on all three levels. But I try to avoid using medication wherever possible. And usually it is possible because there's so much that can be done with supplements and the right nutrition that it's really a shame that that is not utilized as the first resort as opposed to the last resort. And unfortunately, most doctors have been socialized in medical school to believe that nutrition is not important and that you don't need to take supplements. We were kind of encouraged to make fun of patients who brought their supplements to us and asked us, what we thought about that. We were taught to tell them that you don't need to do that. If you're eating 3 square meals a day, you don't need to take any supplements, and that you would get all the nutrients that you need through your food. But that's really impossible in today's world because even if you're eating all organic food all the time, which I definitely advocate, unfortunately, because of the way that food has been grown, the soil that even organic food is grown on is still nutritionally deficient. And that means that you won't be getting enough trace minerals if you're only eating food.
Okay, well, thank you. Let's get into some of those natural supplements that can help us, help my little nurses, right?
I was just about to get to that. So you read my mind. So there are several things that can be helpful for energy. You can get them in different forms. One thing that I definitely think is very helpful is a Chinese herb called cordyceps. 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 And it's actually a fungus. It's a very weird thing, but I'll just tell you that it does help to increase energy, and it especially also helps lung function and stamina. So I would just, probably the easiest, I mean, in Chinese herbal formulas, sometimes they combine this in an herbal formula, but it can be used on its own as well.
Mhm.
And you can buy it in the health food store, and you can try taking it in the directions that it says on the label. Of course, anything that it says on the label could be more or less than what you actually will need. So I recommend starting off with 1 or 2 capsules in the morning, according to how the label says, and then you might need an additional capsule perhaps in the early afternoon. Some people might find that if they take this too late at night, that it might prevent them from going to sleep, but it's not really like caffeine.
So that one is for energy.
Yes.
So, okay, so I should take that in the beginning of the day.
Yes.
Wake up and get energized.
Exactly. And, there are other things that people can take for energy as well. I mean, ginseng is known for giving energy, and there's various different types of ginseng. Some is red ginseng and some is American ginseng. But there's even formulas. For example, I have a formula at my office called Cordyceps, which is a combination of cordyceps and ginseng. So that's a very nice, combination. And in my office, what I do is I actually calibrate to people on the device and test them in acupuncture meridian balancing program to see whether the supplement that I'm testing on the little plate that's connected to the computer actually is harmonious with their body's acupuncture meridians. So if it, boosts the energy of their meridians, or if it helps to balance them, then I might recommend it. If it drains their energy, then I would tell them don't bother with that. You can't always do that, unless you consult me, and you can do that remotely. But you can try these things. You should notice a difference. So that's the best way I can say. Some people might need the cordyceps, some people might need the ginseng, some people might need a combination of both. Astragalus, Astragalus, astragalus.
Okay, and what is that for?
That's for building blood. And so it can give you more energy by, boosting blood, especially if the person is slightly anemic to begin with.
Oh boy. Okay. So
Yes.
we got our morning energy boost. Now, how about for somebody who needs to get a little better sleep? What do you recommend for that?
Well, there's a couple of things that might be really good for that. One of them is tryptophan. So tryptophan is an amino acid that is present in higher amounts in certain foods. So to give you an example, one food that's relatively high in tryptophan is turkey. And you know how after having a
Yes.
nice turkey Thanksgiving dinner,
Yes.
many people become drowsy.
Right.
So part of that, besides the relaxation of just, the holiday and whatnot, is the tryptophan. So I would say like 500 milligrams of tryptophan after dinner might help with relaxation and also sleep. And here's a couple of other things that might be helpful. This one might be helpful in the day as well as the night. There's GABA, which is gamma aminobutyric acid. It's a neurotransmitter, and GABA helps to eliminate or dampen down inflammation in the brain. So sometimes people's brains are on overload and they're just spinning and spinning and spinning, and they can't seem to settle down. Maybe they're feeling a bit ADD-ish. Okay, so the GABA definitely helps that and helps them to focus. So you can use GABA in the morning, and you can also use it at night. GABA won't make you drowsy, but some people, when they get ready to go to bed at night, when they're lying down and they have a moment to start thinking, they start thinking and they can't stop.
Yes.
And they're just thinking and thinking and thinking and thinking. And then the thoughts that they're thinking cause them to not feel relaxed. And then it's harder for them to get to bed. So some people like the combination. One of my patients loves the combination of tryptophan plus GABA at bedtime. And then a third thing that some people might find helpful is melatonin. So melatonin is a hormone that's secreted by the pineal gland. It's the proverbial third eye in the brain, and it makes this hormone, melatonin, that actually signals the body when it's time to go to sleep. Because obviously you wouldn't want to have the same level of wakefulness at all times of day. At a certain time of day, it's time to go to sleep. And melatonin signals the body that, yes, now it's time. However, as we get older, we tend to be either, I don't know whether it's producing less melatonin or less sensitive to the effects of melatonin. Maybe it doesn't bind to its receptors as well. I don't know. But, it seems to often be harder for older people to fall asleep, stay asleep, and not wake up too early and not keep waking up during the night. So sometimes if a person has problems with their sleep timing or their circadian rhythms, they can try using melatonin. And melatonin dosages vary anywhere from, let's say, 0.5 milligrams to 3 milligrams. Some people have even taken 5 milligrams, but I think it's better to gradually ramp up than to start with a high dose, because for some people, not all people, but some people might be sensitive to melatonin. And if they take too much, they might wake up in the morning feeling kind of hungover. So you wouldn't want that. So you might want to start with 0.5, see if that seems to do anything. If not, ramp up to 1 milligram. And somewhere between 1 and 3 milligrams is often the sweet spot for people who need melatonin, although it can be more effective not to use it every night and just use it maybe every other night or every third night. So that's something else that can be good for sleep.
Okay, those are great ideas that I need to try.
Well, it's help. They can help. I will also say this, and this is something that hopefully I can say because you're broadcasting out of California.
Oh, yes.
And that is that I'm a certified doctor in Florida for medical marijuana. And I can say that is something that can be extremely helpful for many individuals as far as sleeping goes. So
okay.
It can be helpful in dialing down anxiety. Sometimes people who are very anxious, and that's what stops them from sleeping, they do best with a combination that is high in CBD and low in THC. Then, there are other people who might need help with sleeping because of pain or something like this. And those people might need something that's higher in THC. It's rather individualized, and it's not like a one-size-fits-all type of a thing. But, even in states with medical marijuana like Florida, unfortunately, you have to have other things that are considered to be justifications for using this, like trauma or PTSD, for example. You couldn't just say, well, this person has problems sleeping, so let's try this, the way that you could with, medication for insomnia. All the person has to say is that they have trouble sleeping, and a lot of doctors will just give them Restral or whatever it is, whatever medication for sleep. But, I often find that that cannabis can be really helpful for sleep and relaxation. So it's not the bugaboo that a lot of people think that it is. And in fact, a lot of older patients benefit from it, particularly because it helps them with things that often older people have, like anxiety or depression or muscle spasms or difficulties with sleep. It can help with all that. But I'm just saying, if you're not somebody who is familiar with it, then it might be helpful to consult a doctor. Even in California, where it's recreational, it might be helpful to work with somebody to find out what works best for you.
So even though you're in Florida, would you be able to help some of our nurses that are out here in California and all over the United States?
I couldn't help them with medical marijuana certification because that's only done within their own state. But, certainly with other things. I mean, I often use the quantum biofeedback device to assess and treat people and recommend things for them at a distance. So it's equally accurate at a distance in terms of assessment. It's only the power of the treatment. Treatments can still be done remotely. But I would say that if the power of the treatment when done while the patient is there and hooked up to the device is 100%, then I would say the power of the treatment when it's remote is about 70%. But that's still pretty good.
Pretty darn good. Starting from zero, right?
Something that can be done, if the person is even halfway around the world.
Well, our time is already up. It's gone so fast.
Wow.
So, yes. So we have to have you back on the show because now as you're talking, there's so many more things I want to learn. So
I would love to come back. This is a very fun interview and I love nurses. If God forbid that I should ever be a hospitalized patient and somebody said to me, you can only have one of these. You can only have a good nurse or a good doctor, but you can't have both. I would choose the good nurse.
Absolutely.
Because the nurse is the person who actually does the stuff.
Absolutely.
Yes.
Thank you very much. Well, okay, so we're going to have more information about Dr. Ahmadi on my website. So go to breakingburnout.com for more information about that and how to get a hold of her. And also, if you would like to be a guest on my podcast, go to my website at www.breakingburnout.com and go to the podcast tab and find out more information about being a guest on our show. So until next Monday at 10 o'clock a.m., have a good week.